Hello and welcome to Positively Thriving, a series for people living with HIV by people living with HIV. My name is Tom Hayes and I've been living with HIV for 9 years and I'm the editor of Beyond Positive. Today I'm joined by Dr. Laura Waters. Laura, if you'd like to introduce yourself.
Thank you, Tom, and hi everybody. I'm Laura Waters. I'm an HIV consultant at the Mortimer Market Centre in central London and I'm current chair of the British HIV Association.
And today we're going to be talking about COVID, of course, and HIV, and how you can get the most out of your virtual online HIV consultation. So I don't know if you mind taking us back to the beginning of this in March, where it all kicked off. What changed overnight for you in HIV care?
So from our perspective as an HIV service, we needed to rapidly change things into a system that was safe and a system that minimised face-to-face contact, driven primarily by people not wanting to travel across London and to come into a clinic, but also in terms of staff and space and distancing. So we moved all of our booked face-to-face consultations onto a single phone list that the staff who were available worked through. We updated our website, we texted every patient where we could, and we also bought a new mobile phone that goes straight through to one of the senior doctors. So any patient wishing to speak to a member of clinical staff was able to do so. That by and large worked very successfully. Like most services, we also stopped doing routine blood tests. We maintained some capacity, and that's the key thing.
Wow, so you've been busy then?
It's been quite busy, Tom, yeah.
So it's 5 months on now, and how confident are you that things are going smoothly and that everybody's getting seen on a timely manner and getting the medication in a timely manner? Is it panned out as you'd hoped?
Yes, I mean, with the caveat that you only know what you know. So as far as we're aware, everybody who's needed medication has got medication, and everybody who's needed some form of assessment has had some form of assessment. One of the interesting things we noted actually was an increase in engagement, anecdotal for us, but certainly other London centres presented some of their findings at the recent AIDS 2020 virtual conference and showed that people who had disengaged from care for whatever reason started to re-engage during COVID-19. And whether that was the trigger of a major life event making people reflect, whether it was the belief, correct or otherwise, that antiretrovirals would protect people against COVID-19, or whether it was just a desire to sort of strengthen their immune system and minimise any risk, but there was also a sort of marked upswing in re-engagement.
So during this I've had, I think I've had 2 virtual consultations with Bloomsbury. The first one was with you just as this was all kicking off actually. And then the second one was with another doctor who I've not met before, and that was about 2 weeks ago. Both of them were fine. The first one was just like chatting to you normally. And then the second one with the other doctor was quite short, but it covered everything it needed to cover. Because, as you said, we're not doing routine bloods at the moment. There weren't the bloods discussed. And there's not the usual chit-chat that happens in a face-to-face meeting. So it's very much, how are you doing? How's your mental health? You know, is there any domestic violence? Is there anything you'd like to talk about? And, you know, here's your medication for another 6 months. For me, actually fine, but I'm sure you've had patients who have had trouble with it, adapting to.
Yeah, although fewer than I anticipated. And again, I don't know whether some of that is just this kind of hunker down, we're all in this together, whatever needs to be done. And I think, I mean, by and large, the patients that we're lucky enough to care for or help them care for themselves are a really resilient, flexible bunch. And I think as long as you explain things, then generally people are fairly accepting of them. One thing I wanted to pick up on, Tom, is it's interesting your use of the word short. I know we've touched on this before, and this perception that phone consultations are shorter. And it's interesting because I think certainly some of our managers might have assumed that phone consultations are shorter, therefore more efficient because you can cram more in. But certainly for me and my colleagues, phone consultations take just as long as a face-to-face, because in terms of the information that you're entering and the follow-up actions and the prescription, all of that still has to happen. And what I find happening with a phone consultation is when we see each other face-to-face, we'll sit there, but often I'm tapping away and sometimes looking at the computer during our consultation. So I'm doing everything in that one visit. For me, the same stuff's still happening. It's just that the listening bit's concentrated and the admin bit is done separately when the patient's no longer on the phone.
So for me, if you don't mind me going first, I think a good HIV consultation is one that leaves you feeling confident and reassured at the end. It's one where you feel like you've been listened to. It's one where all of your issues have been dealt with and you feel like you've been involved in the decision-making process. I mean, what does a good HIV consultation look like to you as the doctor, Laura?
I mean, obviously my goal is to achieve everything that you've described, Tom. But I think for me, it is about feeling everything's been covered and that the patient's confident of the next steps. And your point about making sure everything's been dealt with, that's important to me as well, with the acceptance that dealing with may not be undertaken by me and it may not happen within that consultation. Many of the issues that people deal with, as you'll know, Tom, is not so much related to medical conditions or medications, it's social issues, it's financial issues, it's other issues of life. And that's where, again, our peer support team, our health advisors, where appropriate, our psychology team can all offer additional support, including referral and signposting to other services. So I think it's about feeling that you have progressed things, you've communicated things well. And for me, one of the most important elements is follow-up. Not only when will the next appointment be and how, but also how to access advice in between appointments if necessary.
I think that's really important as well. It's not just the session itself, it's the preparing for the session. So how can I be best prepared in advance for my session to be a good session? Do I sit a week before a reminder and think, what's been happening to me over the last 6 months? Is there anything that I want to bring up in a week's time? Is there anything I want to write down to ask my doctor? Have there been any side effects or illnesses that I want to mention? How's my mood been? How's my sleep been? It's going in prepared, so ready to both have the conversation, but also back yourself up when you're asked about issues.
So Laura, how can doctors, and you're obviously the head of ViiV, so you're the UK's best HIV doctor. How can HIV doctors help facilitate a really useful and productive appointment? What couple of tips could you give any HIV doctor to get the most out of an appointment?
Just for the record, I don't think I'm the best HIV doctor, but thank you, Tom, that's very kind. So I think encouraging preparation, and making sure people feel that's normal, because I think sometimes if you prepare and you come in with a list, you sort of think, am I the person with a long list? And that's a brilliant thing to do. Come prepared and come with a list of issues. And I think, of course, and we learn it endlessly at medical school, but we don't always do it, is the importance of just general open questions. So starting off with, how are you? Rather than, how are your medications? Have you missed any doses? How are you? Or, what's important to you? Has anything been on your mind? What would you like to discuss today?
I think those are excellent points, especially the open questions. I had a doctor many years ago who would ask me 3 questions when I went into the room. Have you taken your medication? Do you want to see your results? Do you need any more pills? Those are the only 3 questions he would ask me in the entire consultation.
Not necessarily very open. Yeah.
No, it didn't leave a lot of room for manoeuvre. It didn't leave a lot of room for him to read into my responses, into my non-verbal cues. It was literally, it felt like an exam almost. And it was over and done in 4 or 5 minutes. So open questions, non-verbal cues, very important. Do you think that, because we're going to be stuck with virtual consultations for a while now, not just because of COVID, but I think probably a lot of services are going to see them as a value. Do you think they have the potential to be more flexible than a standard in-person consultation?
Without a doubt. And I think flexibility, of course, in terms of location, but most importantly, the patient, but actually also the clinician undertaking the consultation doesn't need to necessarily travel. So I've been doing a lot of my phone consultations from home. So that gives flexibility of location. It also gives flexibility of timing. If I've got a book clinic from home that started at 6:30 or 7, and people can choose those early appointments, that's clearly very flexible for both of us. And so I think it does give people the opportunity for their care to fit in better around their lives. Now, the challenge, I think, is the assumption that that's what everybody wants. And I think one of the things that really struck me from our ViiV virtual conference at the beginning of July was some preliminary results from a UK CAB survey presented by Alex Barrowhawk, And the figure I really remember is 9% of the people surveyed said they didn't want their HIV care to be happening on the phone in their own home. They didn't want their HIV doctor or nurse phoning them at home. It may mean actually for those people that we do need to maintain those face-to-face services as a matter of routine, because I'm slightly fearful about making face-to-face an exception, because for some people I think that will need to be the rule, because that's the type of consultation they want, it suits them best, and it's our duty as HIV services to make sure that's an option open to them.
I think you can negate the importance of the time spent with the nurse as well before you see the HIV consultant. A lot of people build their strongest relationship with their HIV nurse or the nurse specialist. That's who they will confide in the issues they feel too embarrassed to talk to doctor with, or the issues that will randomly fall into their mouths while they're having their bloods taken or their blood pressure. So I think that's a really important element that we'd also lose if we move to virtual only. So for me, I think the most important part of getting ready for any consultation, be it real life or virtual, is preparation. So you know you've got a call coming with your doctor in a week's time, or even in 2 days' time. What are you going to do to prepare? First of all, check how much medication you've got left and write that down so you know. Have a think about how you've been feeling over the last 2 weeks, a month, 6 months. Has there been any big issues that have cropped up in your life? Maybe it's cold sores or mood swings, insomnia. Write these things down. Think about how frequently they've been happening. Think about questions you want to ask your doctor. It's an unusual time right now with COVID. Do you have concerns around the supply of medication? Do you have concerns around coming in for blood tests? Write those down so you can bring them up in the conversation. And Laura, do you have any top tips you give to people, probably new diagnosed people, to be ready for their consultations?
So Tom, I completely agree with you that preparation is key, and we encourage people to prepare and encourage them to bring lists and to keep a record, and particularly around side effects, to keep a symptom tracker, because sometimes that may reveal actually it's not related to timing of medication, it's related to stressful events at work or particular issues in relationships or families and the like. But listening to you then, I wonder if we're specific enough, because I'm not sure we really give examples of what are the good things to ask. And we ask people about how much medication they have left. We ask about missed doses, but I'm not sure we really list that those are important things to keep a record of. So that's certainly given me something to think about as we go forward and come out of COVID.
I think sometimes specifics really help, especially when you're a patient advocating for yourself or for someone else.
Yeah.
About 5 years ago, I got the most insane repeated cold sore outbreak. It was one every 2 weeks, or then it got more frequent. I was having several each week. And obviously the week before I went for my 6 monthly appointment, they all cleared up and I had nothing to show. And my doctor said, well, it's probably not related to your HIV, so there's not much we can do, but we'll keep an eye on it. So as soon as they started popping up again, I kept a log for the next 6 months. When they popped up, how long they lasted, when they disappeared. And it went on to nearly a side of A4. And then when I went back the next 6 months, I showed them this piece of paper, this evidence I'd recorded. And his eyes nearly bulged at how many cold sores I've been having in the 6 month period. And they started me on treatment for it, and I've had almost none ever since. It's being able to advocate for yourself, but sometimes that requires evidence, unfortunately.
Yeah.
So I think as people living with HIV, it's on us sometimes to prepare for a doctor that perhaps isn't as open or ready to take our word for it. So at the beginning of lockdown, Laura, just as it was happening, we had my first virtual consultation over the phone with you, and I switched my HIV medication. I was a bit surprised that we were doing that, given that there were no routine bloods happening. But you said it was fine. Is this something that's still happening during lockdown? I mean, it's gone smoothly for me, but what about everybody else? Is it something you're comfortable doing?
It is. I mean, the sort of national guidance around managing HIV during COVID, and ViiV put together some interim contingency guidance, discourage people from making unnecessary switches. But I think the individual case, it's going to depend on the person, it's going to depend on the nature of the switch. And actually, these days, thankfully, we are often switching to regimens that are really safe and very simple. Some switches where you will anticipate more side effects, then you would be less likely to undertake that. But again, if the reason for switch was important, if it's a drug interaction or an intolerable side effect, then clearly that's going to tip you back towards switching. And I do think most switches can be undertaken safely virtually. And I think probably at least 70 to 80% of switches could be undertaken without necessarily a face-to-face interaction. The very key thing with any switch, which applies whether that's undertaken face-to-face or virtually, is it doesn't have to happen when you discuss it. Let's discuss it, have a think, come back to me, there may be a couple more questions, or decide not to switch or to delay switch. So giving people that breathing time and that ability to go away and research their options is absolutely crucial, whichever way you do it. And then really the key thing about needing to come back is to do blood tests. But if you're switching to a safe combination with a very low risk of changes to your liver or kidneys or anything, with no risk of the viral load suddenly going up, as long as the person I'm speaking to is feeling well and managing to take their medication in the way that they are supposed to, then actually blood tests aren't necessarily that essential. But again, the importance of ability to contact us if you run into difficulties, good follow-up, appropriate tests, I think the switch can be undertaken completely safely in a virtual world.
Here are some top tips to get the most out of your appointment. Keep notes about how you've been feeling and any changes to your health and mood. This could be how you've been feeling generally, anxiety, depression, insomnia. Keep a change of any medications you've been on. So this could be prescription medications or over-the-counter medications. Be proactive and do your own research about issues that might be affecting you or any medications that you'd like to switch to. And if you've got anything you want to discuss with your doctor, this could be health-related, medication-related, or about the clinic generally, write it down. Use the notes app on your phone to write it down so you can discuss it at hand at your next appointment. I hope you found this video useful. I'd like to thank Dr. Laura Orsis for joining us.
Thank you for inviting me, Tom. I've really enjoyed it.
And you can find out more about Positively Thriving at livelife.com, where you can find videos, podcasts, stories, and more. Positively Thriving, for people living with HIV, by people living with HIV.